This is Shanwa with Safine Psychiatry. When it comes to treating bipolar disorder, one of the most useful frameworks is thinking in terms of mood phases. Let's break this down and see how it can guide treatment decisions. Before we get started, please remember this is for educational purposes only. Bipolar disorder has three key phases: acute mania or mixed episodes, acute depression, and long-term maintenance aimed at preventing future mood episodes. Importantly, among acute phase episodes, mixed states are extremely common. With this framework in mind, the goal of medication treatment is straightforward. Ensure there is at least one effective drug for each relevant mood episode. Let's walk through an example. Imagine Jim arrives in a clinical setting during a manic episode. A clinician would prioritize starting a medication effective for acute mania, often a dopamine blocker like aripiprazole or quetiapine, or a second messenger modifier like lithium. One option is to use a single medication that treats both the acute phase and continues into maintenance, such as quetiapine. However, if quetiapine is continued long-term, its metabolic risks accumulate over time. Alternatively, the clinician may start a dopamine blocker for immediate anti-manic effect. Let's use quetiapine again for this example, while simultaneously initiating lithium. Although lithium is effective across all phases, it typically takes longer to exert its full therapeutic effect compared to quetiapine. This combination approach allows for rapid symptom control while establishing a foundation for long-term mood stability. Once Jim reaches remission, quetiapine can be discontinued while lithium continues as maintenance therapy. In other words, quetiapine served its purpose in treating the acute phase, but is no longer needed because lithium can maintain mood stability independently. Another notable example is lamotrigine. Although it can be highly effective for maintenance treatment, it has limited utility in acute phases. If Jim were to experience an acute mixed episode while on lamotrigine maintenance, the clinician would need to introduce an agent with proven acute phase efficacy, such as a dopamine blocker. Effective bipolar disorder management comes down to this: matching the right treatment to the current phase of illness. Thank you for watching. If you found this content valuable, please like and subscribe.